Good afternoon, everyone. Welcome to today's webinar hosted by Patagonia Health. Today's webinar topic is on diversifying your public health agency's revenue streams. If you aren't familiar with the Zoom webinar platform, take a look at the control panel on the bottom of your screen. Here you can configure your audio settings, send chat messages, and ask questions. As a quick background about our speaker, Deborah is a public health advocate with experience in persuasive communication from her role as a legislative liaison for the Iowa Department of Public Health. She founded DHT Consulting and Training to support health and human services professionals. Deborah is involved with the Iowa Public Health Association, the Iowa Immunizes Coalition, and volunteers locally. She lives in Urbandale, Iowa with her son, partner, and his children, and most importantly, enjoys gardening, traveling, and adult coloring. Without further ado, I'm going to pass it off to Deborah.
Thanks, Dana. I appreciate that introduction. I really love gardening the most. That was definitely my happy place all summer. All right, we're here to talk about money ideas. First thing, I want everyone to know that I am aware that my screen is not in presentation mode, so don't worry about having to let me know that. The reason I'm doing that today is because I did my presentation in Canva and I wrote my notes in the notes feature. If you guys don't know Canva, here's a little tutorial. I have a lot of links for you guys today, and it doesn't let me cut and paste the way that PowerPoint does. So lessons learned, pros and cons of each platform. But on the flip side, you kind of get some captioning from me today. And for those of us of a certain age asking for captions more often, maybe that's not such a bad thing. So money ideas, we're talking about diversifying revenue to your public health agency today. The outline is really short. We're going to acknowledge and honor the, next hard thing in public health that puts us in the mainstream once again, in the national discourse, just like COVID did. But we're also going to put into some perspective to maintain our sanity, what's left of it, because the topic of health isn't going to go away. We are also going to learn from each other. The ideas that I offer may or may not be new to you. If you had some experiences with some of the things that I'm talking about or some of the sources I'm talking about, please put them in the chat. Tips and tricks. We are all learning together. And I really just as a culture want public health to really come together as a community in this next phase of challenges. The learning income outcomes are really basically what was shared in the paragraph that attracted you to this webinar. So I won't repeat those. And so we will arrive at the state of affairs. And it is, no one is under any illusionment, I'm sure, that the Trump administration has made their mark on health and human services in America. Between firings, guttings, cuttings, reductions, shootings, and resignations in the first 9 months alone, there has been a lot of things to absorb and push forward through. And unfortunately, there is nothing in this presentation that is going to change the fact that things have been flipped upside down and sideways. And I'm not here to give you hope that we are going to someday magically return to the before times. This is all really happening. So what we have to figure out is how to push through together. Because I think we have to also acknowledge that while we're not going back to what once was, I'm not really sure that, that definitely wasn't a perfect service delivery system, and we weren't doing things the way that we would want to. So inherently, as a professional in public health, we've got this, we do this. Sudden, unexpected change, uncertainty in day to day operations, we train for this. And diversifying income to the organization has always been a smart budgeting practice, because we know as public healthers, and especially those of us who've been around a minute, funding streams dry up all the time. It's feast or famine. Sometimes there's a ton of money, like there was the past few years for COVID. And then sometimes there's just not enough, like there is now. So there are ebbs and flows, mountains and valleys, and funding streams, trying to figure out, you know, what your big ones are, and then the places where you can find flexible funding to fill in the gaps that your government funding isn't letting you cover. We've always been kind of hustling on the side to get the needs of the community met. And that's one of our superpowers, is resourcefulness. So we have the skill sets, we have most of the skill sets to get us through, to mentally prepare. But there are some skill sets we need to pick up on and do a better job. And I swear I'm getting to the funding sources. Um, when this is also an opportunity, it's a time to kind of rise from the ashes and reevaluate and assess the situation, figure out, as the community health strategists in our communities, what do we know, what can we do, and who can help. And I think that we may want to go back to the ideas that were being promoted at the national level about the future of public health in the 21st century from the Obama administration. So here comes our first link. I'm going to dust off this 3.0 paper for you guys, because this was going to be our North Star. I don't see why it can't be again. 21st century public health. So it was a groundbreaking assessment of the need to evolve as a profession already to meet the needs of current and future generations compared to those of the past. Some people may think, public health 2.0 was infectious diseases, 3.0, 4.0 is going to be about chronic conditions. So we have to evolve the way we have in our history to meet these needs. But these new skills aren't necessarily regularly embraced by the profession. So this is kind of a new doubling down, I guess. So sales, becoming salesmen and women, salespeople. Public health is a brand. If we think about it as a brand, this is flipping the narrative, changing the narrative. Our brand has some issues. But regardless, making the healthy choice the easy choice is an idea. Prevention over direct service is also an idea. Those of us who were around for the Great Recession in 2008 may remember the value judgments that were being made over where to put uh, their funding. So is it direct service, meeting the needs of the people suffering now? Or is it continuing to invest in prevention in order to assure future generations the ability to not suffer from the same things or suffer from the same fate? Unfortunately, in 2008, it was almost a false choice. It was direct service over prevention, not even both. And in Iowa, where I live, we did not recover from that, and we remain at our lowest funding levels since 2008, where we were at our peak. So prevention over service is an idea, and these ideas are not everyone's truth or their priorities. So we do have to think of ourselves in competition for America's attention on the critical need to create a culture of health. So we really have to sell the idea to people that their health in connection with the health of others in the community is worthy and necessary of investment. So as legislative liaison. And what that is the point of contact between a state health department and the state legislators, sometimes congressional staff for me, but mostly state legislators. So I was going in between, you know, the farmers, the non-public health types, you know, the muggles over here, and then my public health professionals back at the department. So as I'm doing this as a legislative liaison, I was competing with advocates. Technically, we're all on the same team in terms of shared values of wanting your community to be healthy, thriving, wanting people to be successful. But when it comes down to it, uh, we all want special attention paid to our specific interests. So whether that was childcare, financial sustainability, housing, all of these things are worthy of investment and attention. As public healthers, we know that they're determinants of health that are non-medical factors. So when I realized this early in my career, that what I was doing was very similar to what my father does as a salesman. I happened to find a book called Dale Carnegie's How to Win Friends and Influence People. And my little government self, I texted my brother and I said, Lou, is this something that business types read or care about? Is this like a valid resource for understanding sales? And my brother took over my dad's business and he retorted, yeah, it's like there are workshops regularly, and come to find out there's this whole Dale Carnegie Institute. So what do I know? I'm not in the private sector, but I did find it and it does help. And it's a very short read. That one I don't have a link to because it's as easy as Googling Dale Carnegie's How to Win Friends and Influence People. That can get you started on your salesmanship, your path to being a salesperson. Communication. And I'm not talking here about marketing or social media. 21st century skill sets. This means the art of reaching out, speaking authentically about the issues in your community and asking for help, making the ask. Oh, it's so hard to ask. Authentic communication, that's referring to the honest and open exchange of thoughts and feelings, fostering genuine connections and trust between individuals. So I'm talking about vulnerability, expression of values, of feelings. I have not said data. Data takes a back seat in these conversations. Don't get it twisted. I am not abandoning data, nor would I ever. But data is appropriate in certain settings and not a value add in others. And I'm saying that data does not add value in the types of conversations we need to be having with other leaders in our community. I say this acknowledging that we all have strengths and weaknesses. And if emotional, being vulnerable, is very challenging for you or difficult for you, there is no judgment here. Only a request for self-awareness that maybe you aren't the best person to be building relationships and being the face of the organization, even if you're the leader. Um, if there's some magic unicorn in your organization that doesn't know a stranger, makes friends with everyone, regardless if that person is the executive assistant or the receptionist, maybe there's a way to find, maybe there's a role for that person to play. I always tease epidemiologists, and that's my longstanding relationship that I had with the EPIs at the state health department. They are some of the smartest people I have ever met. I will never understand everything their brains are able to do, but this may not be in their wheelhouse. Yes, they are the subject matter experts, but that doesn't make them the right person to build bridges. So my point in saying this is that moving forward in public health, we have got to let go of the titles and work toward a more egalitarian profession that celebrates the strengths and weaknesses of what's traditionally considered the grass tops of the organization and the bottom of the organization. Um, so, communication, relationship building, asking people, hey, let's go get a cup of coffee. I just want to pick your brain. What do you think the state of affairs is? What are we doing as a community? Who have you been talking to? I'm having my own conversations like that. I've even had a dinner party with leaders in the public health community in my home just to get some movement going. Because a lot of our leaders, I think rightfully so, may feel a fight, flight, or freeze response right now. I'll talk about that a little bit more in the community foundation space. So, values-based communication is a short title for what I'm talking about. Values-based communication. The best resource for me on this was The Righteous Mind: Why Good People Are Divided Over Religion and Politics. That's a thick book. You could also go back to the webinar I gave in April that is on the Patagonia Health website of offerings. And you'll hear me talk about moral foundations and values based communication in the vaccine hesitancy webinar I gave in relationship to vaccine hesitancy. Okay, cross-sector collaboration. That Public Health 3.0 paper that I put in really hammers home cross-sector collaboration. The idea that the 21st century problems that America faces are too big to tackle alone as a sector. They're just too complex, they're too nuanced, and they involve too many sectors of the economy now that we're into determinants of health and non-medical determinants of health. Um, so we need to start reaching out, and the 3.0 concept kind of put us in position as a community health strategist, or it said chief health strategist, but I think we all kind of and said community health strategist is a bit more approachable as a term. So cross-sector collaboration. Now I'm stereotyping. um, the stereotype about cross sector collaboration, I put buildings here because for some reason that phrase, or maybe it was the way the paper read, made me think of people in suits who maybe golf in their free time and know a lot about stocks and Wall Street. So I suppose I go in with a little bit of that bias when I'm having conversations with people in different sectors. And then it's, all about, it's never as intimidating. I guess I should say that those folks in suits who golf in their free time and know about stocks and Wall Street tend to be a bit intimidating for me, because I don't know that I know their language as well, and I know they certainly don't know my language of public health. So I'll give you an example. What we call outcomes, they call KPIs, key performance indicators. So that's just some, awareness that we speak a different language from with folks in the private sector, even in the education or the insurance sector or in public safety. So we have to respect the fact that we can't go in with our alphabet soups of, acronyms and short titles and catchphrases. We need to be mindful of speaking plainly and in plain language, which is hard. So luckily, other people have put together some things that were really getting a lot of hype and focus before COVID hit, that I don't think that we should lose track of. So I'm kind of reminding folks about it if you heard it already, introducing if it was before your time in public health. So De Beaumont Foundation, many moons ago, they put forward the phrases framing tool. So as you enter into the relationships that you would need to kind of take advantage of the funding sources I'm going to move on to, there are ways for you to kind of prep your mind, not script, but prep what you want to say, what your key takeaways are. So phrases literally means public health reaching across sectors. I need to put that in the chat. There you go. I used this as a liaison and it just swapped words for me. Again, just going back to KPI versus outcomes. And it did do a good job of helping people understand the difference between public health and healthcare, which is always the first thing that I feel I need to address with folks. Um, I'm just going to let you kind of soak it in here for a second. How the field of health is transforming to meet your needs. So in salesman, it's let me tell you what public health can do for you. It's always about what public health can do for you. Are you a company that um, has high turnover and presenteeism and absenteeism is an issue for you? Um, let's see. Oh, I'm just looking in the chat real quick. Okay. Thanks, Dana. Um, that's what I was saying. This is what public health, when properly supported and champions, can do to decrease the turnover and absenteeism related to chronic conditions and just being an unhealthy employee. Um, I've even thought it'd be interesting, Dana was telling me a lot of you guys might be local public health practitioners or local public health administrators. Um, and so I've even thought, like, if you were going to go to a grant maker focused on diabetes, it's really, this is what the public health system can do for the issue of diabetes writ large. So again, it's kind of putting forward what our superpowers are. We are a we are a problem solving strategy. Our 10 essential services, our 3 core functions solve problems. And I have no shame in going back to the 20th century and recalling the CDC's study of the 10 public health achievements that gave the American lifespan 25 additional years. I don't know why we don't have more swagger around that. My goodness, I cannot think of another sector of the economy that has that kind of demonstrated success. So we have the success of our ancestors. If we pull that forward into this century, it's just about connecting the dots for people. And I have never had a situation that I can recall where someone has been unimpressed with that, where that was just like a meh. Usually I get big eyes and, oh, really? I had no idea. Oops, I turned off phrases. Sorry about that. Okay. De Beaumont also has a toolkit to really have you go step by step through a process that, you know, yeah, step by step through a process that helps you get some notes on paper so that you have some general idea of what you want to make sure that you hit in your conversations. Okay, so take these skills into the next settings. And this is a parallel process. Okay, so don't wait to master any of these skills that I just talked about before before reaching out to make relationships. Uh, that's not what I'm saying. All right, our government, federal, state, local, that's still in play. The FY 2026 budget is outlined, quote, um, in what's called a budget in brief. So it highlights what they're thinking about in terms of health for the MAHA, Make America Healthy Again. Um, and so looking at this, we see chronic disease that's been mentioned several times by RFK. Researching environmental toxins, funding, that's for our academics. MAHA, 240 million. They're still looking to support indigenous populations. And then probably not good news for Head Start. This is reform with no money attached. But there's still money. It's not going to be as much, but there's still money. We will still get money from the government. In Iowa, which is a deep red state right now, this is just one person's observation. When the federal government makes reductions, they expect the states to pick up anything that needs to be picked up in terms of priorities for that state. So, if they're going to cut maternal health funds, and Iowa's really worried about our infant mortality rates, which we are, then we need to advocate at the state level to supplant or to give that funding, to not let that funding, completely diminish. In Iowa, the state has been pushing down to the local level the responsibilities. So that's confusing. I think what I'm trying to say is there's no clear level of government holding their hands up as we're the responsible ones for health. No one's really claiming that ownership of it. So unfortunately, that means that advocacy at all levels is going to be necessary. Advocacy is a whole other presentation. It's not for today. I just want us to start embracing that as part of our job functions and part of our roles. It is on the 10 essential services wheel now after the refresh in 2020. So getting to know your local, in Iowa, they're called county supervisors. Then we have our city councils, because city councils will give grants. You can get money from your supervisors. A lot of you guys probably are primarily funded at the county level. So those relationships, maintain those. Get to know your state legislators if you don't know them already, just to help them understand even what the new priorities of the administration are going to be and how that lines up with their stated priorities, either as a caucus or the governor. Um, you know, However your power dynamics are set up in your state. So in Iowa, our executive branch is more powerful and influential than our legislative branch. So we would spend more time with the governor's office trying to get onto her list of priorities than we would the Speaker of the House or the President of the Senate. Okay, so I talked about the government. Now I'm going into the whole world of philanthropy and community foundations. Matt McGarvey is a friend of mine. He is the foundation executive director for Telligen Foundation, Telligen, and he's over 4 states, and I can't remember which ones. Um, so I have talked with him a little bit. Um, and let's see. Okay, just keeping an eye on the chat there. Um, okay, so he and I were kind of talking about just like the general vibe he's catching from his colleagues in the community foundation space. He's seeing some withholding of grants by funders right now because they're too nervous or uh, they're not sure what priorities are going to be important. or funded. And this is part of the freeze response because I think it's a direct reaction to the clear increase in demand for their funds. And so it's almost like when everybody needs help and needs help now, it's kind of a frozen, oh my God, I'm just not going to give money to anybody because I don't know how to tell people I think their stuff is more important than another person's stuff in a moment of crisis. Arguably, that's what they're telling everybody in every grant cycle. But right now, there's heightened emotion and desperation coming in. He can tell that he's had this is Matt now, the most grant applications for this current cycle that he's ever had. Um, and that he is getting applications that are clearly just throwing stuff against a wall, trying to hope somebody somewhere will fund their proposal or meet their needs. So in other words, they're not taking the time to really clearly see intelligence uh, priorities and assure that it's matching up with the grant. So that's an organization filling out applications for anything, just hoping to hit something. Um, I suppose I assumed people know what community foundations are. I can back up a little bit and explain that these are organizations who meet with, build relationships with, and provide outreach for folks in the community who want to donate money to improve the conditions of their community, to support the work being done to make it a thriving community. And so they are kind of somewhere, I think, between a business foundation and maybe government, where they know about the community, and they are conversational about the issues, and they are good at matching the community needs with what the private funders' goals are. Community foundations are also good places for education on fundraising. If you're somebody with an organization who has a board of directors, or even if you're an agency with a board of health, there's also usually good trainings and resources and coaching to help make those people work for you so that they are truly helpful, and not just, um, I'll just leave it there, period, so that they are helpful. Okay. I'm so sorry that the links aren't going as well, but I know Dana's doing the best she can. And like she said, we will follow up with this, and this is recorded as well. So the links I'm putting in right now, there is a association of community foundations. So that's the Council of Foundations. And it has a foundation locator so you can find out the ones in your area and in your state. The second link is from a website called pridephilanthropy.com. And it helped me understand the state of affairs in that space. An analysis of contributions by individuals, foundations, and I can't remember the third category, and what they're observing in terms of trends for giving to gosh, just inform us. There are, again, this is a good opportunity too. Uh, if you have a partnership with a community foundation or a regional foundation or a local foundation, if you have any tips or tricks, you know, pretend that you were going to explain to your child Hey, this is how you should approach. I don't know. That's a weird analogy. I'm just saying you can't expect all of us to know how to interact with community foundations if we haven't had that experience. But if you've had that experience, I'd appreciate you guys putting that into the chat so that we can learn from each other. Um, I find folks at community foundations to be very, very friendly, to be very well intentioned, and to be cheerleaders trying to empower. But they have a sticky icky of maybe over promising and under delivering. So while I think that they are a powerful potential partner, I just want folks to know that, you know, uh, that they're cheerleaders and they don't mean to be getting hopes up, but I think that's just a natural you just when you want to help, oops, accidentally I kind of overpromise because I don't want the person to leave the conversation feeling sad or hopeless. Let's see some other things. So I talked to Matt, I've talked to a couple of other folks in that community, and let's see. Flexible funding with unrestricted dollars. That's another superpower of the community foundations. Government tends to have a lot of requirements, restrictions, reporting, even the applications are a huge pain to fill out because they're long. But these community foundations have easier applications, usually have less reporting requirements, and you have far more agency to use the funds based on your expertise and knowledge. Some of these folks offer rolling time frames. So what that means is that there's not an actual end date for your opportunity to apply. That so if they say rolling time frame, that just means that what they'll likely have you do is meet with them first, and by them I mean the staff. And sort of pitch your proposal. So, like that 2 to 3 minute elevator speech that you will find in Dale Carnegie's How to Win Friends and Influence People. And they'll let you know what your probability of success is. Um, they have very competitive um, application processes, though, for all of those points. Talked about that. Even if the staff, oh, yeah, we've got some good guys. Pay attention to the, oh, thanks, guys. That's awesome. Pay attention to the chat. There's good stuff going on in there. Let's see. So the other piece of the community foundation staff is their network. These people have connects. They know, so even if they're not able to help you within their own foundation, the stronger the relationship you have with them, the more likely they'd be like, hey, but I know that this person over in this foundation is looking at that. So let me make sure that you guys are connected. And if they say, I know that person, but they don't offer to do the introduction, ask anyway. Say, oh my gosh, that would be so great. Do you mind if I ask you to make the introduction, or do you mind if I name drop you? In a way, that's a compliment. That means you're an important person, Matt McGarvey. I will name drop you to get it in somewhere else. So yeah, in summary, they can open up doors for opportunities that aren't typically advertised. Um, and so these people become gatekeepers, and we want to sell them into champions. Um, so a vision of success would be that they call you when they are made aware of an opportunity because y'all have talked about it in the past, and they'd probably be really excited to know they were able to help in the long run. Staff work with many community-based organizations, and so again, if you're not if you're a government agency and you don't have strong connections with your nonprofits, um, and other helpy helpertons in the community, then they can make those introductions too, and make sure you ask. And if they offer and then you don't see anything for a couple of days, get in there and say, hey, great follow-up, great, thank you for your help. I really appreciate that you offered to do this, and hold them accountable for what they offered to do for you. Okay, I hit that one pretty good. Let's see if there's more. Um, Talked about nerves about demand, temporary withhold funding. Oh, okay. So, the one thing that stood out to me as interesting and notable was with a business foundation executive director that I was talking to. So let me get on. I'm going to go back to the national organizations. So, these business foundations are in the private sector. They're typically found in large employers. So, here's some um, examples in Iowa. We've got a chapter of Business Solver. North Carolina does too. They're in both our states. And Carrie Clogg is the foundation person there. Come and Go, I guess now that's Maverick, but Come and Go is a gas station. Iowa's gas station culture is really strong. So Come and Go has a foundation as well. Wellmark, our biggest insurance company, has a foundation. Principal, one of our Fortune 500 headquartered companies, has a foundation. Carrie told me that a lot of these folks are looking for ways to engage their employees in volunteer opportunities. So if that's what you're promoting, you may lead with that. And always, because it's business and that's okay. What's in it for me? What's in it for me? How do I get my name out? How do I make sure that the community knows that I'm making this very valuable investment? So keep that in mind. And as an extension of that, if you have conferences or events or activities, ask these folks, well, if you can't give me a grant, would you mind being a sponsor and donating like $500, and we'll put your name on some of the marketing for the event. These folks have their funding priorities posted online as well, so do your research. This is all about efficiency. We assess and then we move forward. Tribal foundations, oh, I didn't mean to have that still on there. Tribal foundations came up in a meeting I had with another group of locals. And I hadn't thought of this, probably because of just a narrowness and assumptions and stereotypes of who they would want to fund. And so she was a local public health agency administrator, and she did emphasize, though, that the importance of the relationship. So this is not going in and just trying to get the funding, or throwing your applications at them. This has historical sensitivity that we have to be mindful of. And Lord knows, I hope I don't have to explain that. But this one, I didn't want to not include, because there's clearly opportunity. So, for example, like in Iowa, we have several reservations who have casinos, and those are probably the first places to start. But again, you may need to network into that. So if and actually I can put, so for rural folks, this is familiar to you, because what we know about rural communities is that you can't just show up and start talking to people. You've got to be introduced into the community. You need a person to kind of vouch for your character in a way, and that's just culture. I'm going to go back to the national organizations only to just brainstorm these, because we know who Robert Wood Johnson Foundation is. Annie Casey is a funder that I ran into in nonprofit land. So I'm not sure if everybody in public health knows about them, but they're really in the child care, early childhood space. CDC Foundation still exists. It's still there. I checked this morning. Kaiser Permanente has community grants, and actually, I do have a grant, I'm sorry, a website for that one. And then as I move along in the last 15 minutes, please put your national organization in the chat that isn't listed here, like one you can think of that I don't have here. Chat. Okay, that's Kaiser's. Robert Wood Johnson Foundation has a lot of different grants. They're still committed to equity and health equity, and they're doubling down on it. So there is one grant in particular called Pioneering Ideas that seems to me to be the biggest flexibility of funding to still allow you to work on health equity issues, and that has a lot of flexibility. But it's a rolling fund, which means you have to talk to the staff first and have that conversation to see if you're aligned. MCOs and pharma. If you have states that have Medicaid, that have privatized Medicaid, like we have here in Iowa, you have companies that are interested in making community connections. Our plan people, we have got Centene. Centene is the parent company of our plan. Iowa Total Care. AmeriGroup is a parent company of WellPoint, and then Molina is Molina. That's a regional MCO that's a little smaller. So again, this is a connection thing. If you have MCOs, it is likely you've already interacted with them in some way. But these are potential partners and they are interested in novel ideas. So if you've got new ideas that people are nervous, they maybe don't want to try new things, this is a good spot to try, especially if it decreases their costs to insure. Same with pharmaceutical companies, although not unequivocally. The woman who runs Merck, I don't know her name, I'm sorry. She's a public health professional by training, and so they have a lot of community grants of different categories. My friend Sarah Strawbridge works for Merck. She is a government relations person for immunizations. And so we've been fortunate in Iowa with our Iowa Immunizes Coalition to receive funding from Merck for the past few years in order to keep our coalition strong. If anybody else has a different pharmaceutical company they've been working with, please put those in also. Thank you. Ooh, Rockefeller. Okay. I don't know what I was going to say on that one. Oh, there are grant tracking websites, and it doesn't look like I filled the rest of this slide out, so I'm so sorry. What I will do here is make sure that Dana has that as part of her follow-up, because this is something that just came on my radar. That's why it's a sloppy slide. I was talking to one of a person that like her job is to do the fundraising for organizations. She's a consultant, and she has a couple of websites that she uses to find grants. They're like these centralized websites, much like a .gov kind of website. So I'm sorry about that, guys. Okay, novel ideas, because this is also a time for innovation. I was curious if a government agency could create a nonprofit. So I asked the executive director for Iowa's Ethics and Campaign Board, no, Ethics and Campaign Disclosure Board. So they kind of govern, um, you know, well, they govern government. They kind of govern the elections as well. Like that's where our candidates file their spending reports and things of that nature. So I had talked to them before about what government employees can do in terms of advocacy. So I kind of went back here first. And this is a big block of text over here, but effectively what it says is, in Iowa at least, there's nothing that says you couldn't start a Friends of Public Health nonprofit for fundraising and to solicit personal individual donations from the community. Unfortunately, we might have to start borrowing some ideas from our friends in law enforcement and firefighting and get some of those fundraiser events going. And what else do they do? Pancake breakfasts and things like that. It's not fair, it's not right, but it might be part of the hustle moving forward. And so if we can, kind of maximize it through the nonprofit structure, it's just something, it's just an idea. And I don't necessarily know anyone that's done it successfully. Um, it's just an idea. So what she ended up telling me was there's nothing that says you can't, but I would also check in with like your local city attorney, city and county attorney to make sure it's not in violation of any laws either. The other one is a novel idea. Now, this one came to me from a contract I had where we were exploring the need for a community health center. Oh, that's what I mean. Community health center. Sometimes they're also called federally qualified health centers, so FQHCs. They're a big part of the safety net, and they're very mission aligned with public health, more so than I think we realize. We, I think, tend to think of hospitals and physicians as our natural partners, and I'm wondering if we should look a little harder at CHCs because of mission alignment and a past in social justice. So CHC lookalikes are a very long-term strategy. I almost just want to introduce the term. What they are is effectively creating a community health center in an area, um, and taking advantage of the funding streams that CHCs get for a lot of the services that some public health professionals are providing in their communities, like oral health or vaccines. So, what we were looking at in Johnson County was how we could leverage the public health services, CHC, community health center funding streams, because they get funded. They get funded, and they're going to be darlings of the Maha movement. We have to respect what they've done to position themselves. They've done a lot of advocacy, a lot of lobbying, a lot of education and relationship building with the new administration. And so in that FY26 budget, if you take a look at it, there's a full-on paragraph that says community health centers will be a cornerstone of Maha. So those are important partners, but they're not unfamiliar. They work with prevention. They want community health workers as a part of their team too. And they're looking to get more outside of their walls as well. The ones in Iowa are, anyways. And they also measure and screen for social drivers of health, for social determinants of health, uh, non-medical factors, whatever you're calling it these days. Okay, I'm going to stop here. And with 7 minutes left, 6 minutes left, are there questions? Are there things that I'm totally off on? Don't send me away with misinformation. I'll feel that's a betrayal. So if I'm off on any of this, you should let me know. If you have any questions, you should ask them now. I was just going to return to phrases if we had more time. What felt the hardest of all of this? Was there any new information? You can put that in the chat. We're on a webinar, so you can't take yourself off mute. Okay. Well, if there wasn't any new information, I'm sorry. Okay, good info from Tina. Um, there are just some acceptances, of the situation right now and what we're in, but it's nothing that we can't overcome. I believe in us as a profession, and I know that we can do hard things. Public health has never been for sissies. None of you guys, you're all empowered people that want to help your community, and there's no way that can ever be bad. And that's all I've got. So I really appreciate your attention and letting me just share what I'm coming up with these days, sharing with each other what you guys are coming up with these days, because we are all going to have to compare notes for the foreseeable future, if we haven't been already. So thank you for everything you guys do. I just, you know, just thank you. I'm proud to
Thank
advocate on y'all's behalf, and you make it easy.
Thank you so much, Deborah. Somebody just put in the chat, they're looking especially for grants that will focus on senior services and isolation. Um, anyway, so a lot of people have been writing down these ideas. I don't know if you know of any off the top of your head, Deborah, for senior services.
Not for senior direct services, but I'm going to put the isolation piece in a novel idea category. That's actually where my head is at right now. And I'm shopping around proposals that are effectively give us money to um, create events that are embedded in adult learning principles. So, maybe we handle isolation, but also tackle civics and community knowledge as well. But the pitch is kind of mitigating expectations. Um, does it hit the ear funny to say, hey, I would like to do events, even though I know direct services are drying up? That might hit ears funny. So we really have to say, hey, prevention still matters. Nothing in public health is one big idea. We are very simple, which is why we're upstream. Put in a sidewalk, get a shot, have more events. It may be that simple. So we've got to get people out of the idea that this is not a grind, that this is going to have one big idea that will all of a sudden get us out and make everyone healthy and create a culture of health in America. We are grinding it out. And we need people to come down to our local level. So I think that it is a good idea to push with your community foundations. Um, and in Iowa, we have ADRCs, which are Aging and Resource Development Centers. And so we have quasi governmental organizations. If you have that in your state, I suggest asking them where the direct service funding is and their thoughts on the approach to isolation with that population.
Awesome.
Events may not be right for them either. I don't know.
Yeah. People are saying that at least in Illinois, there's an agency on aging that has some grant funding opportunities there. Ohio has some opportunities. Anyway, those are just some ideas. But yeah, somebody has said that this would be helpful in one central place, all of these resources and people's
Yeah.
comments. And I am more than happy to put together a little doc afterwards. After we're done with this webinar, I'll put together a doc so that people can see all of these resources because this was super helpful. Thank you so much, Deborah.
Yeah, anytime. Thanks for having me. I appreciate it.
Of course. And as always, if anyone would like to learn more about us at Patagonia Health, we are an integrated EHR practice management and billing solution designed specifically for public and behavioral health organizations. If you'd like to learn more about us, visit our website at www.patagoniahealth.com. Have a great day, everyone.